Good afternoon and welcome to this live on preparing both parents' health for a healthy baby and the role of lifestyle correction in this matter. Every Wednesday, we have a live on health related to lifestyle disorders, diseases, and general health. On Saturdays, we have the same in Malayalam at 3 in the afternoon. So for those of you who would like to watch in Malayalam, this will be available on the previous Saturday. But the topics will be slightly different because it is more focused on a English language audience. To begin with, a bit about Dr. Jolly, who will be with us today. Doctor is a trained gynecologist and obstetrician, and she began her practice in the early 90s. That's more than 35 years back. And soon her focus was into infertility treatment. And it is from this background in infertility treatment practice that she started developing an interest in lifestyle correction under medical supervision for overcoming many diseases, disorders across different specialties. To begin with, what happened was usually for patients for fertility treatment, there was the issue of unexplained infertility, or there was issues of not conceiving in spite of various procedures like IVF, ICSI, etc. So she understood and tried out how to improve the health parameters of the parents, both the mother and the father, such that it could influence the fertility of their fertility. So to this end, she found that there was a very big impact on correcting lifestyle in overcoming fertility problems. With this in mind, she structured a program whereby both the mother and father could follow guidance across different spheres like nutrition, activity, stress, sleep, etc., such that their bodies were optimized for better fertility. From this, she transferred this knowledge and tried to apply it across different specialties for different lifestyle disorders, such that the improvement in health under clinically supervised lifestyle correction would benefit individual patients, ranging from chronic disorders like diabetes and hypertension, cholesterol, and then also including autoimmune disorders like arthritis and psoriasis and so forth. And slowly she understood the vast impact this had on n number of conditions under and across different specialties. Today we are focusing on the health of the parents before they conceive. The first question that we have is, when it comes to fertility, normally when there is a problem only, the parents think of their health. And that too, when they think of their health, they are basically trying to overcome the infertility problems. They rarely, if any, Even though they may be having some chronic disorders, they won't see that as an issue. So in this context, how is it possible for these young parents to think in a wider way such that, they are able to understand the complexity of fertility?
All the young couple, before giving birth for a child or planning for a baby, they should use all the latest knowledge in the science about the human life and human development. And basically, every person should understand that what we eat is actually what is our body. It is same for the baby also. Baby is formed from a sperm, it's a half cell, and a egg. And it is also half cell. Half cell means it is only having half the amount of genetic material. And two half meet together and form a full cell. And from that cell, the baby's body is built. So the preparation time, the formation of the cell and the formation of the sperm and formation of the egg time, that usually takes around 3 months. And for that development, for the maturity or the ripening of the egg and the sperm. So that time itself we should take care. Then only you can have a healthy baby. If it's actually the parents' health is directly reflected on the sperm or the egg. And the maternal health, definitely the baby is developing inside the womb, inside the mother. What she eat or what her feelings and everything will be affecting the child also. So proper preparation or pre-pregnancy planning should be there. And if you are able to give that, definitely the health of the baby will be improved. And not only the physical health, the mental health, intelligence, intellectual level, everything will be better. So if it is happening for all the couple, so the next generation will be definitely a different health in the mental and physical health will be much different for the next generation. That is what we want. We want a healthy next generation, healthy society, healthy baby, and healthy world.
As you said, the importance is to have, when you look into the future and the importance of the health of the baby, there is nothing that can be spared for that. So anyone who has any understanding of that will definitely take care. If pregnancy is not happening naturally, what is happening generally is people look into the infertility aspects. That is where they run to. They go to an infertility specialist. At the same time, they don't go and do a general health checkup otherwise and focus on correcting those aspects as well. Because once they go for infertility treatment, then that treatment becomes very intensive and that way it goes to a large extent. So what is it that such patients should realize?
First thing, before, at least till now, you may not be knowing about it. If you are seeing this video or if you are exposed to this sort of an understanding, you should definitely go for a health checkup, not an infertility checkup. So basically, infertility means, or you are not able to conceive means, what it meant. It means just that you are, either of you, maybe both of you, the couple, are not fit for bearing a baby. That is it. And or if you are getting an abortion, that means if you are getting an abortion, that means that there is not a good environment in the uterus, or that genetic material of the baby is of abnormal. So it doesn't have the capacity to grow into a human baby. So that is what the studies are also done in many abortus material of the genetic material. is very good number is abnormal genetic composition itself. Or if it is abnormal genetic composition, the mother's womb is not fit for giving opportunity, giving optimal atmosphere for developing into a mature baby. So, before first thing, we should understand that before we going for each pregnancy should be a planned pregnancy. The mother and the father should be ready for welcoming the baby, not to the world, to inside the womb itself, and do the preparations. Minimum 3 months preparation has to be done. This avoid smoking, alcohol, and all the junk food, the color preservatives, and make sure that the nutrition balance is okay, and the body composition, you are doing enough exercise. And then definitely in this now the health is very much advanced, and we should have a health checkup and see that whether your nutritional status, hormonal status, you have you are pre-diabetic or you have hypertension, or we can find out all the by a health checkup we can find out many things of your health and find it and correct it, and then only plan for a conception.
For those who are having this repeated miscarriage or failed IVF and failed ICSI or unexplained infertility and all, so at that time they will be already in some sort of very strict infertility treatment regimen. So at that time, how will that treatment get along with correcting lifestyle under clinically supervised conditions?
See, when I give a fertility treatment or infertility treatment, or for the recurrent abortion treatment, or patients who are coming after repeated IVF failures, or patients who are coming for repeated congenital abnormal babies, or those who are coming after giving birth to an abnormal baby, or a mentally retarded baby, or having even some non-congenital abnormality problems like Down syndrome and all. What we do is, what I myself do is, we do a detailed test workup of the patient, and if it is genetic congenital anomalies or chromosomal anomalies is suspected, we can do a chromosomal analysis also and find out the what is the situation of the couple presently, and then make them in a optimal health, mentally and physically. Mentally, because those who are coming for infertility treatment, usually they will be prepared for they want a baby, but many of the times in at least in our Kerala atmosphere, or in maybe in India, and I don't know about the Western countries, but in the developing countries at least, and they'll be under social pressure of not having a baby. So they are not really interested. Many of the couple may not be really interested in having a baby or parenthood, but they want to silence the critics or the society to they are the capacity, they have a baby, or otherwise they will be branded as infertility and they have some problem. So that should not be the aspect. We are actually inviting a new life into the earth, and we should be in a very positive manner. It should not be because of the pressure, societal pressure. It should be from the real need. And for that, we had to correct our lifestyle first, and basically understand that if there is a fertility problem, it mainly depends on the fertility of the health of the father and the mother. So correcting the health is the root or the base of building up the fertility.
Nowadays, because of the consumerist nature of life, obesity itself is something that, if we mention obesity, it is something like we are not doing the right thing, and it is against the feelings of many people and all that. But whatever said and done, it is seen in preconception studies and in other such material that obesity is a major factor that decides the conception, the delivery, the health of the new baby and everything. So when it comes to clinically supported lifestyle correction, what is it that you focus on in this matter?
See, actually active treatment, before giving active treatment, I always prepare the body. The first 3 months will be given for the preparing the body. Preparing the body means giving an atmosphere for the sperm and egg. The sperm and egg development time, and prepare the body for the father and for the couple, and to get a healthy sperm and egg. In that, it's very important that the body composition of the patient, the couple, husband and the wife. And sometimes the people may be overweight, and we see also underweight also. And I can give you an example for a patient who's and this couple, actually one is overweight and the other is underweight. They were trying for pregnancy for a long time, actually infertility treatment itself for a few years, 4 or 5 years, and they had tried to IVF also. They actually, with the IVF, they got conceived, but early abortion took place. And after that, they came to me. And in this, the wife is very much underweight. She was 161 centimeters and only 41 kg. And the husband is overweight. He is 184 centimeters and 96 kg. So in that case, what I tried is to reduce the weight of the husband and increase the weight of the wife. For that, we analyze the blood parameters and we have a protocol actually, clinically supported lifestyle correction with the cell activation protocol. Cell activation protocol means to stimulate the cells inside the body with the food, exercise, and that exercise meant to increase the circulation. When you increase the circulation, each cell, not only the ovary cells or the testicular cells, we are not focusing only on the sperm or the egg. If we are focusing, we cannot do like that. When we are trying to improve, we should see the whole body as a whole thing. And around 50 trillion cells are in the body. We are focusing on all the 50 trillion cells and give them optimal nutrition, optimal activity, that is exercise. We can activate the cells only through the exercise, so that the circulation is improved and the waste material, the toxic accumulation is there, it can be expelled. And that way prepare it. And this patient actually within in a systematic way, we can around in 20% reduction in the weight within 3 months. It is possible if it is overweight. And in most of the patients, within 2 or 3 months, enough underweight, it is more easier for correcting underweight. We can, within 3 months, we will be able to reach the optimal health and reasonable optimal composition if it is not too much overweight. And then only we start with the infertility treatment as such. Infertility treatment also, we'll explain it in another thing we can explain.
See, when we are talking about this obesity or overweight and all that, normally at that age, maybe in the 20s and 30s, what is seen is that obesity will be there and pre-diabetic stage will be there, or diabetes is not noticed because glucose readings are normal, but they will be having higher insulin levels, and basically they are in a situation where the higher insulin levels are actually controlling their glucose in the blood, but they are not obvious of, they are obvious of it, they are not aware of it. And some of them will have some feeling of understanding that they are pre-diabetic, or some of them may even have become or shown signs of diabetes. So in case of these patients who are high on insulin, blood insulin without any insulin injections, or they are pre-diabetic or diabetic initial stages, in such cases, what is it that they should be aware of?
The patients who comes for a health checkup before for the infertility, as a part of the infertility, or just as a preconceptional planning, what I see is many of them will be having multiple problems. Generally they'll be healthy, they don't have any problem. They even the light increase in the obesity problem, they will not be noticing itself. Generally 10 or 20 kg overweight, no one consider it is overweight. Many patients they will not be diagnosing it as. But some may be thinking about, I am little overweight, so I want to correct it and I want to see. Say one the lady, actually a couple came, and the lady is having, she was thinking, I am little overweight, I want to correct it. And she's 162 centimeters and 72 kg. So definitely she is overweight. And when we look into the blood parameters, she has so many other, she was anemic, hemoglobin is low, 11, and vitamin D was so low, and zinc is low, and folate level was low, and so many nutritional abnormalities was there. And even her this inflammatory markers, ESR and CRP was high. This is that BMI is high, and excess fat in the body. So many problems will be there. And usually, if you think that generally when we look into, or the patient is okay, no symptoms, but when we look into, there will be many problems will be found out. And the most important thing is, and many of this can be corrected within 2-3 months, within 1 or 2 months itself. Usually blood parameters is light inflammatory markers and all will come normal within a month itself. Like a nutritional abnormality, we can correct it within a month most of the case. And if at all, if it is pre-diabetic, we can correct it, and we can bring down the insulin level, and also the SbA1c level to around 5.5. We always advise, if the pre-diabetic or already diabetic patient on medication also, if it is type 2 diabetes, we can, the patient, if willing for weight reductions, many of them will be overweight. If you reduce the excess fat, no, not just weight reduction, if you should reduce the excess fat, not the muscle and bone. If you unscientific way of weight reduction can bring your muscle and bones down, you should not do that. You should, when the ideal lifestyle correction means increase the muscle and bone mass and reduce the fats mass alone. So we can correct it, and we can come out of diabetic or pre-diabetic condition, and the hypertension, if it is there, or the cholesterol is high, you can definitely correct it and then go to the pregnancy.
Actually, when we are talking of this hypertension, as you said, how is that? How should it be understood by such couples if either of them have hypertension? What should they understand about how it can possibly affect their fertility and their child?
See, hypertension, we can simply, with the blood pressure, now the digital measures are all is there. And most of the homes also will be having a BP apparatus nowadays, because parents or someone will be in the hypertension. So if you find that with that even you don't have to go to a clinic for checking for whether you have the hypertension. So check yourself, and for the obesity also, whether to see whether you are in the your weight is normal, you just check on the weighing scale. Will be also, every home should have a weighing scale, because that is the most easiest to find out what is the situation of your health. Ideally, in Indian scenario, your height minus 110 should be considered as your normal, and height minus 100 is the upper normal. Don't take the height minus 100 is normal. It is height minus 100 is the upper normal for the Westerners, Caucasian and all. For the Indian, it is always keep below height minus 100. So if you follow that, or if you have an understanding, then it is very easy. If you are keeping your weight height minus 110, then that's, and doing reasonable exercise and avoiding junk food and reasonably healthy food, then the chance of getting diabetes and hypertension will be very low. But definitely, if you have a genetic predisposition, your father is diabetic or hypertensive, or mother is or your family is diabetes or hypertension is running in the family, then you should be more careful and check this. And if it is, even if your genetic, your family is having predisposed to this, then again, if you are correcting your lifestyle and optimizing your body composition, you can escape. That is actually called epigenetics. Even if the genetics is predisposed, you can control you cannot control your genetics. DNA, you don't have a direct control of your own DNA, but you can control your epigenetic factors, and that is the possibility of correcting the clinically supported lifestyle correction. And through that, correcting your epigenetics, you can reduce the chance of abnormal or negative DNA transmission or the genetic transmission itself. You can reduce by optimizing your own health.
Actually, when we are talking about women's health, this PCOD and allergies and all are actually a very big part of many people's health. And how is it that these sort of issues can be impacted by clinically supported lifestyle correction, especially when they are planning to conceive a child?
See, PCOD is a direct problem for the conception itself, because it's a hormonal irregularity. First, it starts as a metabolic irregularity, and then that is, in most of the patients, there will be overweight or at least excess fat in the body. And thus starts the metabolic irregularity, because excess fat body accumulation itself is a sign of the metabolic irregularity. And when the excess fat is accumulated in the body, it will lead to hormonal imbalance, hormonal irregularity, and leading to anovulation. That means egg is not produced in the correct time. Usually we know that I think everyone will be knowing that this is that's a developmental cycle for the egg, and the 14th day usually in the 14th day or around that day, the egg is matured and it comes out, and it is within 48 hours is the fertile period, and ideal time is actually the egg is coming out within 24-hour. Fertilization has to take place, and then the growth of the child and all. And this ovulation will not happen in the PCOD. That is what is the PCOD means, or PCOS is a polycystic ovary. More the cysts are coming inside the ovary. That is actually immature eggs. The egg is not getting mature. So many immature eggs are embedded in the ovary. So that we had to overcome. It is there. This anovulation will make the hormones from the brain, FSH and LH, will be irregular, and the ovarian function will be irregular. Usually this will accumulate, and the androgenic expression will be excess. The female will be having more male hormone expression. That is why they get this hirsutism and also male pattern hair loss like balding. That is usual for the PCOD patient. So it will definitely lead to infertility. So PCOD has to be get corrected in the natural way. But usually in the infertility treatment, what we do usually is to induce the ovulation by stimulating the FSH production. But before that, that is well and good. But before that, we had to correct the hormonal milieu. Then, if the ovulation is not happening properly, then only go for the stimulation or induction of ovulation. That is always, we will try to increase the fertility of the each couple, but first thing is correcting their body composition and correcting the metabolism and correcting the hormones first, then go for the induction.
What about allergies? Because if many patients or many individuals nowadays have allergies, so when they are planning to conceive, they will be sometimes under medications or some other controls and all that. So what is it that they can actually do with respect to correcting their health using clinically supported lifestyle correction?
See, allergy means there is an overreaction. Your immune system is overactive. The patients with the allergic response will be having some hidden other health issues also. They may be presenting as the sneezing or recurrent respiratory infection or asthma or itching. If you are going with all these health issues into the pregnancy, it will be very difficult. And also in many patients, it is the pregnancy may not be successful also. Or in such a case, I can give you an example of a couple. And the wife is overweight and she is having PCOD problem. And husband is actually is on the leaner side, but he is having allergy and always sneezing and recurrent respiratory infection. Every month he has to go for antibiotic therapy and all. And they had many IVF failures and even three times IVF failure and 2 abortions also. So these patients also first is correcting from the wife part of point of view, we corrected the overweight and she was overweight part, excess fat is reduced and the ovulation, trying to correct the ovulation, but she was not able to even after reducing the weight, but no one will wait for a full weight reduction or full body composition correction because they cannot wait too much. So after 3 months, by the 3 months, we'll get around 15 to 20% weight reduction. And then 4th cycle onwards, we try. And that time, if there is not ovulation, we can induce ovulation. There are tablets and also definitely FSH and LH. That is, FSH is the most used for the induction because the hormones from the brain, we can inject it and it will give the ovulation. We will study the ovulatory cycle, and we can now with the modern diagnostic technique we can pinpoint the ovulation. And for the husband, he had allergy, and we analyze what all things are producing this allergy and try to avoid that allergens. And usually they'll be having some nutritional deficiencies and other problems also that also get corrected. And he had actually he had actually if he go to the seaside, he got used to get sneezing and respiratory infection. But within 3 months of treatment, actually he was telling that he went to the seaside also, he didn't had any problem. But many of the things we may not be able to avoid also. This air you cannot avoid, cannot control, you don't have the control of air quality, but you have some control of how your immune system is responding. When you correct your immune system, this air quality also will not much affect you. That is the importance. And after the correction, then we induce the ovulation and conceived. And that's also IVF failure patient, but they are able to conceive without IVF itself.
When you said about this IVF failure, this IVF failure or this ICSI failure, how is that and all connected to the health of the parents?
See, IVS and ICSI, all this artificial ART procedures is done as a last resort in the infertility treatment. But nowadays, it is so common and so many IVF centers are there in Kerala itself, I think many, maybe 20 or 50 or I don't know how many. So we generally we jump the couple also, they want a fast result. In this scenario, everything is need fast. So what is happening in the IVF? Actually, we are giving injections to produce many eggs and then taking it out and fertilizing, taking the semen from the semen and separate the sperms, and they are meeting in the lab petri dish, and this zygote is formed inside that, and it will be after 3 days or 4 days. It will be that all the IVF centers having different protocols, and it will be transferred to the womb. And in the olden days, actually in the same cycle itself, nowadays these embryos are frozen, and many IVF centers now don't use that sperm and that cycle itself and keep it for the frozen situation, and another cycle when the couple is ready, they transfer. So we are going out of the nature. It is good. Actually, this IVF is developed for the couple or basically ladies for the tubal block. When the tubes are blocked, there is no possibility for meeting the egg and sperm to meet. For that situation, it is developed. But nowadays, it is generally used as a shortcut actually. And for the ICSI also, ICSI is actually in this IVF, we are just the sperm and egg is meeting in the petri dish. But in the other thing, in the ICSI, the sperm is injected into the egg. That is when the sperm is not able to penetrate the egg and get fertilized. So there also we are forceful entry is done. So there will be definitely that problems will be continued in the next generation also. And there can be other, I am not going into the details of the problems which can occur. These all have the positive things definitely, especially those who are male tubal block. There'll be sperms will be formed inside the testis, but it is not coming out. In that case, it is a very if it is the sperm development, sperm is not able to come out. In such cases, there may be some use and all, but whenever you use the correct your proportions and your health, and give a best atmosphere for the baby egg and sperm to develop, and then go for all these procedures, then the result will also be better.
See, in the case of preconception health management, generally we find that as the age increases, most if not almost all parents will get their health parameters slightly wrong and all that. So when they are in that situation, if they are going to correct the health parameters and then think of conceiving a child, how immediate is the improvements generally, if you look from your experience? How much what is the rate at which they can actually improve their health in a very short period of time, say 2 to 3 months, such that they can be more confident about conceiving a healthy baby?
In the clinically supported lifestyle correction, we focus on the first 3 months is the most important crucial time. And that is, from my experience, what I see is within 3 months, what all lifestyle diseases are there in the young couple who's planning for a conception, they will not be having very serious issues like failed kidney, fourth stage of renal failure, or such person are not trying for a pregnancy. But they'll be having usually overweight, obesity or overweight will be there, or hypertension will be, or diabetes, or some arthritis, such problems will be there. Usually within 3 months we can come out of most of, if the patient is following the lifestyle instructions correctly, they can, if it is overweight, you can reduce around 15 to 20% of weight reduction. 15 to 20% of the weight reduction will give you, in the scientific way, if it is given, it will be definitely the diabetes and hypertension, all these aspects will be, you will be out from that. And then the 3 months, that is the egg and sperm development time, because maybe you can wait 1 or 2 months. The exact time is actually 75 days for the sperm and egg. So wait for another 1 month or 1.5 months, then try to conceive. So before 6 months, you can definitely, for 5th month onwards, definitely you can, 4th or 5th month onwards, definitely, if you are following things correctly, by the 3 months, the problems will be corrected, and then try to conceive. And if the things are going fine within 6 months or so, you will be able to definitely go for, if you are getting no ovulation is taking place, or the sperm motility or things are low, you can go for IUI. First induction of ovulation and try for IUI, that also is a natural cycle. Then if the IUI also failed, they tried the ovulation induction and the timing, the correct timing, IUI also is done. Then failing, then only I would at least try for 3 cycles with correctly doing the IUI and the ovulation induction. Then you are not conceiving, then definitely you can think of IVF. But if you are doing in such way, the number of IVF for the ICSI needed will be very, very low.
One thing that we often see is, as you said, the hormone level problems are quite common. At the same time, this thyroid also seems to be an issue of concern for even young people. So what is it that can be done if they have a thyroid problem? What are the types of thyroid problems that are normally seen?
See, thyroid problem, one is thyroid nodules. It was very common in Kerala. This multinodular goiter. That is mainly because of the nutritional deficiency. Iron deficiency was one of the reason. But with the iodization of the salt, it was reduced. But now the major problem is the Hashimoto's thyroiditis. That is an autoimmune disease where the TSH start hiking, then T3, T4 and all the thyroid hormone is the real thyroid hormone start reducing, and it is treated with basically hormone supplement, that is thyroxine is given, levothyroxine is given and treated. So, but that is only hormone replacement. Here the real problem is an autoimmune disease. Your own immune system is attacking your thyroid gland and destroying it. Our treatment is only supplementing thyroid deficiency. We are correcting the thyroid deficiency only. The real problem of the immune system is left behind, untreated. What we ideally should do is we have to find out why my immune system is going half aside and why it is not behaving in an abnormal way. Because especially when you are trying for pregnancy, this will happen with the placenta also. There is an immune problem. It is attacking the thyroid. And when you conceive, there is some major immune problem is there. The baby is an outsider. There will be a attack possibility is there, but because of the nature, it is so much understandingly and the immunological corrections are done. That is why a baby is able to survive inside the womb. So that mechanism is already under stake because the autoimmune activity is there. In such cases, the placental circulation can be affected. And for that, actually, we usually gynecologists, especially this fertility specialists, give certain injections to not making the blood clot inside this thing, that is lonopin injection, low molecular weight heparin and all is. That all is taken every day before, from the conception, even the ovulation onwards, for those who are having recurrent abortions, especially this thyroid problem patients, the chance of getting recurrent abortion, if it is conceived also, the chance of getting abortion is very high. In that case also, if you correct your body and correct the metabolism, you can correct the immune system, and even the autoimmune antibodies will start coming down. And then try to go for the pregnancy. Within 3 to 6 months, this can be achieved. It's a lifestyle correction or the under clinical supervision, it will give a very fast result.
Actually, when we are talking about nutrition for the baby and all that, it is normally considered that, after this pregnancy has been confirmed, then suddenly everyone goes after nutrition and all that. So at the same time, all these studies and all show that, before conception or within some 3 to 4 weeks itself, after conceiving, even before the mother has realized she is pregnant, many of these actions and activities have already reached a stage. So this managing nutrition and food and all is, before that itself, it is very important. So when you are talking about this correcting lifestyle, you are focusing on nutrition and physical activity and all that. How far is it that, the parents know that this is so important before they actually conceive the child itself? Or do they even now think that after conceiving they should go and get the best supplements and other things and all that?
See, in a natural course, if you are not caring, this couple is living a family life, and they will look for the missed period will be missed menstrual cycle will be noted only after 2 weeks. Or if it's a patient is on a regular cycle, now because of the obesity and so much of hormonal imbalance, this thyroid problems and all, many ladies are not getting the correct menstrual periods will be very much irregular. So they'll be just ignoring it. And maybe after 4 weeks or after conception, 4 weeks only, usually we come to know about it. And if it is an irregular cycle, even late. By the time the baby's major development, even by within, if you look into this with a good quality ultrasound scan, We can see within 6 to 8 weeks, we can see the beating of the heart and the brain development and the heart development all is reached in a very fast phase. These changes are taking place within the heart formation and all is very early. Before you notice the pregnancy test is positive, these all things are happening. So with this modern understanding, each child should be born with the real preparation from the mother and the child. It should not be an accidental pregnancy. And I have seen many people, this even in nowadays also, many pregnancies will end up in abortion. That is MTP itself. In India, I think India is the first country to make the MTP legalized, medical termination of pregnancy legalized. And we have that option also. And many pregnancies are happening without the preparation from the husband and wife. And they opt for the abortion also. So it should not happen. There are very effective contraceptive measures, and the couple should be responsible and use the contraceptive measures if they are not planning. And when they want a child, they start preparing 3 months before, and with a good understanding, you can even pinpoint the ovulation time. That is also very important. Around the 6 hours around the ovulation window is the best time, because the egg is fresh and the sperms should also be fresh. Should not be an aged sperm or the aged egg to get the best possibility for the baby. So study that and apply it in your life.
Actually, when you are talking about general health, even though the pregnancy and all normally takes place at early ages, we find that sometimes at least one of the father or mother or both will be having some early stages of fatty liver or even second grade fatty liver and all that. What is it that they can do regarding that, or is it like it is generally found more and more in present population, so it doesn't really matter?
See, many people, I'll give an example of a patient itself. This lady got pregnant, conceived, within a year of marriage, they conceived. And when they gone for the antenatal checkup, she was found to be having her HbA1c 9. She was not knowing that she was diabetic or anything. And she was overweight, 75 kg, but she is having 167 centimeter, very tall lady. Reasonable for Indian standards, it is 167 centimeters tall, but overweight. And she, after conceiving only, she came to know about her HbA1c 9, and the gynecologist advised this baby may be having there is a possibility of having congenital abnormality, so get aborted. And then because she is diabetic, they started on insulin. And again, when the HbA1c is 6, they try to conceive, and after the pregnancy is test positive, even with insulin, she was not able to control the blood sugar. In that stage, she came to me, and in that actually at that stage itself, with the clinically supported lifestyle correction, within 2 or 3 days, she was able to get her blood sugar under control without insulin injection, and she was able to maintain her pregnancy with the normal glucose, and it never crossed above, HbA1c never crossed above 6, and she was able to give birth to the healthy baby to the baby at term itself. So if you have, that is the importance of pre-conceptional checkup. And if this lady was checked for the pre-conception checkup, she would have found out the HbA1c, and we found out the her diabetic status. And in that stage also, if it is a type 2 diabetes, the ideal methodology is to correct the lifestyle. If you are able to correct the lifestyle, that is the first in the modern medicine, the first step of treatment, first line of management is lifestyle correction for the diabetes, hypertension, all these lifestyle diseases. And if you fail only, you need to go for the other medications. For in my experience, if you are going for this systematic, structured lifestyle correction, that I'm following is CSLC-CAP, that is a systematic way of monitoring also. And you can we can de-prescribe the medications, not blindly just stopping the medicine or anything. The following, if it is a diabetes, follow the blood sugar, follow the carbohydrates in the food, and make the patient understand how much she can have, carbohydrates she can, and correcting the nutrition, we can come out of these problems. It is not happening because you are not, the modern medicine also, we are not concentrating on the lifestyle correction. We are always going for the medical and surgical remedies, which is easier for the doctors and easier for the patient also. The patient should be having a willingness for the correction, and the doctors, this is not happening in a very busy OP, handling everything. It should be only, we should have a clear protocol and there should be clear monitoring, then only it will be possible and successful.
One thing that is never usually mentioned but is very important before pregnancy is considered to be muscle health. So normally we see that no one is thinking of that. What is it that would be parents should know about their muscle health and their body composition, etc., while they are planning for a pregnancy?
See, our body's health is definitely is proportional to your muscle and bone mass. Now the problem in the universal problem, in the global problem is the obesity or the overweight. Almost more than 50%, or I don't know, more than 60% or 65% is either obese or overweight, even in Kerala. What if you are taking, even the children also becoming overweight. So we should expect in more and more in the future days. So what we should understand that you should prevent the excess fat accumulation and see that your muscle and bone is preserved, and build up your muscle and bone by the age of 25. After that, there is definitely a decline will be there. Otherwise, we have to keep it like that. So it is very difficult to build up muscle and bone in your 50s or 60s. So build up your muscle and bone that you can achieve only through doing physical activity. And now the children are also playing the computer games, not the physical games. So it's a problem. The children is not, today's younger generation is not getting enough muscle and bone, and they are accumulating excess fat. That is the reason for this increase in the lifestyle disorders itself. So we have to change, we have to understand, first before making a change, we have to understand our metabolism and what is the life itself and what is aging. And the children are actually, when we look, we have measures to find out the body age and also even the vascular age. What I'm saying is, before in the clinically supported lifestyle correction, before we start with, we do this, not only we consider not only the calendar age, the real body age. That is actually a calculation based on your lean mass and fat mass. And also the vascular age, that is how much fat is accumulating inside your blood vessels. So it's vascular aging is too fast, and we are seeing that at the age of 60, the vascular age may be 260, 200, 170 or 200. And so that is the situation at currently present. So that those patients who have a high vascular age, the chance of a heart disease will be high. So those things we have the facility for that, and we should use that and not just use it and don't think that there is a remedy, that's a medicine for decreasing the vascular age or decreasing the body age. It has to be through the lifestyle correction. That your lifestyle decides your body age on your vascular age.
Actually, one last question, that's regarding medications. Many of these young couples may be under some sort of chronic medication. So what is it that they should know about that? And of course, we cannot say they should just stop it. That's not the way. But what is it that they should know about their medications? And how should they understand how they can actually utilize that understanding for their child's future?
See, chronic medications are generally, one is for the diabetes, hypertension. Then for the young couple, it is the epilepsy medicines and also psychiatric medicines. See, diabetes and hypertension, it's very easy. And you can see, you do the lifestyle correction, see the blood sugar, see the BP. You can taper off. That is what the treatment what I give is for the type 2 diabetes and hypertension and all. With the lifestyle correction, we can reduce, not just blindly stopping, but we can come out of medication. For the diabetic patient, we changed over the major this insulin and such a insulin increasing medications we stop on the first day itself. Then there are other medicines like SGLT2 medicines and all that will increase the excretion of the glucose. Such medicines we use and control. It is possible to control within 24 hours itself. You can get, if the patient is able to understand and follow the things, within 24 hours you can get a blood sugar control without type 2 diabetes medicines. And only when they having craving for the carbohydrate, and then such situations they can have the craving is there, they cannot control it, then take it and use that is SGLT2 type of medicines. That is occasional. That will settle with the diabetes, type 2 diabetes. Then the BP, you can, when you adjust and when your body composition is corrected, when your metabolism is corrected, the BP will come down and we can reduce. And usually, what I am saying is 1 or 2 medicines only within a month. Usually within a week or 2, the BP will start coming down. We can come out of it. The real problem is with the epilepsy medicines and also the psychiatric medicine. That will take psychiatric medicine also. If you are planning for a pregnancy, that means you are in a good mental state. In that case, definitely you can correct this and taper off the medicines. And see, you should, the husband and wife is there, both of them can assess their own health, mental status also, and the parents also can assess and come down and stabilize and then try for conception. Medicines definitely will hamper the development of the child, especially psychiatric medicines and this sort of epileptic medicine. Then it can definitely, even the brain development and all can be affected. And the epileptic medicine also, if you are willing for that and with proper counseling and proper lifestyle correction, you may be able to taper off. And also you can, many of the epileptic medicines can give problems unless if you don't take this folic acid and nutritional correction, because they will take so much of nutritional deficiency can be there when you are on chronic medication for the epilepsy. So those aspects can be corrected and you can come down, and sometimes you will be able to come out of medication, and you can EEG, that brain electric wave checking and all we can do with the help of the neurologist, and the lifestyle correction coordinated with the neurology and the EEG studies. You may be able to reduce or optimize to a more safer drug and then go for consumption.
What about the patients who are having issues with autoimmune diseases and also allergies?
See, allergies and autoimmune diseases, they'll be flaring, when clinically supported lifestyle correction, what we do is we do a detailed blood studies regarding to find out which are food or the things which is reacting to make a reaction or immunological reaction in them. And what we see is the most common is one is this Hashimoto thyroiditis, next is rheumatoid arthritis, next is psoriasis, and the people generally people are coming to, they are trying for pregnancy, they are on methotrexate. They cannot have methotrexate and such medicines while they are pregnant. It is very embryotoxic. So they had to come out of, actually in effect they had to come out of all the medicines. Then only you should try for the pregnancy. And above all, we had to find out which is actually creating problem for you. Some food is creating problem for you. Some pollutants in the air may be creating problem for you. And you cannot have control on the air much, but you can avoid the perfumes. You can avoid this many of the synthetic things that which you apply as a cosmetic, and those things are actually creating problem and immunological imbalance in you. So understand the immunological mechanism, how to playing it in your body. By doing, there are modern tests available for that. You can see whether you are allergic to milk or you have bodies. It may not be allergy alone, it can be intolerance, the different type of immunological reaction are there, and then correct it and come out of these medicines. And it is very I'm actually working with this autoimmune diseases. So this those people who's on 3-4 medicines like steroids and methotrexate and rifaxitinib, or even the injectables, the biologicals, even those who are not getting symptomatic relief with or having side effects with that, they're all able to come out of the gradual deprescription, and remission can be achieved. You can get the free period and understand which all things will be creating problem for you, and avoid such things, and keep the medicine for the use only for the emergency or when it is needed, not in a continuous manner. That is what I am following, and I find that if the patient is willing to can have an understanding about their own body and follow what is their limitation, their body's limitation, then it is very easy actually to come out of the medication. And but medicines are very useful, but it should be used very judiciously. And in that case, it is during pregnancy also, it will not make much of the trouble. You may not be needing so much of medicine.
So with that, we come to the end of today's live. I hope you all you've all been able to get a better picture about the question is not, can we have a baby now, or how can we have a baby now? But how is it possible to give the baby the best possible start by taking care of health in the proper fashion? And for this, definitely planning is very much a part of it. And as we understood from this discussion, it is not something that should be planned on checking out whether the pregnancy has taken place. It should be much before that. First, with understanding that the health of both the mother and father are monitored, and the parameters, if any, are wrong, they are corrected. And most importantly, to see that if any medications are being taken chronically, it is reduced or stopped under medical clinical guidance as much as possible, so that the baby has the best possible chances of a very good healthy start. Next week, on the next Wednesday, we come up with our next topic, which will be asthma and allergies. There too, on Wednesday, 3 p.m., we will be focusing on how asthma and allergies can be managed and, if possible, reversed using corrections of the lifestyle under clinically supported conditions, and where medicines have to be used if it is possible to reduce the intake of medicines, as real health comes only when dependence on medication is reduced to the extent possible and the person is able to become a normal, healthy individual. Thank you.